Join.
Yep, I'm on.
Okay.
Hi,
Hi.
Ed.
This is weird.
Hello, how you doing?
Hi, good. How are you?
Doing good. Okay.
How'd it go earlier today?
Earlier today, I think it went well. There were
Good.
some good questions, and we probably have 7 or 8 people that were doing some research for doctors and prescriptions and things like that. But people seem to be, they've been nice about it. I've gotten several compliments about the presentations, very informative, and we're getting back to people pretty quickly. And so far, it's been a good thing.
Good. How many people were on earlier?
Excuse me. I think we had 37 in the morning and 28 in the second meeting.
Oh, wow. I'm surprised. I thought it would kind of die down by now. I thought.
I think, I was going to say the same thing to Joey, because I think after tonight, I think what's happening is a lot of the same people keep coming on.
Right. That's what I saw.
So I'm wondering if we need to do next week, and we still need to do, we have 3 scheduled for Wednesday, but I think it's a lot of the same people. And
Yeah.
so I really don't know.
Yeah, it's something to look at. Do you think it might make sense if we took some of these questions that seem to be relevant to a lot of people and post them? Like if
Yeah. Well, as you say that, Linda, we're creating a document. So every question asked on all the meetings so far, we've logged and we got the answers. So we're going to create a document for the district, and they can put that out on the website.
Great. That's fantastic.
Yep.
Yeah, I was thinking of doing that because I manage the website, and I was thinking, I can just listen and write the question and answer. And then I thought, before I do all that work, I'll see if you guys are already.
Yeah, no, I've had Kristen Wall in every meeting so far, and she has put down every question and with the answer, so we can get that out to people. And and it's a lot of the same questions, and I get that. And we'll have it there, and they can look at it.
That's great.
I think I'm starting to lose my voice from all these meetings today.
I'm sure. I'm trying to unmute. I guess as the host, I have to unmute people. Kristen, I see you're unmuted, right?
Well, what you should do is you should mute people while I talk.
Yeah. I'll do that once I'll welcome everybody, and then I'll mute them.
Yep. So is Joe not going to be in tonight's meeting?
No, he's not. He asked me to run it because he's got a board meeting online. So he's on another Zoom.
Oh, okay.
School board.
Okay.
And I would imagine a lot of the people that are interested in this, a lot of the employees and retirees would be at that meeting to see if anything transpires about
Right.
this.
Well, a few of the board members were on. I know early on Amy was on.
Right.
So I think a few of the board members were there, so they can hear for themselves. The meetings were going, I think, pretty well.
Yeah.
I think we've answered a lot of, so there should be some positive feedback going around there. And, like I said, I mean, we're trying to address every little thing that we could think of just to put everybody's mind at ease. And so there's a lot of side topics that I kind of attack as I go along, just to make sure that people know that we're addressing everything pretty, in a pretty detailed way.
Yeah, it sure seems like it. I mean, the presentation is really thorough. The chart is great. I mean, it spells it out. I understand people when they have questions about, the different terminology whether it's 100% no cost versus, zero copay. Is that
Right.
the same
Yep.
thing? And that sort of thing, which is just, company to company difference. But it's very thorough and really easy to understand. You guys did a great job.
Good. Thank you. Well, that's what we're hoping. As I tell people, all we could do is educate people the best we can. And everybody has like their horror stories. They heard somebody had a problem here, and it's kind of hard to speak to things like that when you don't know. Like I said to Joe, if an employer buys a cheap program and puts limited benefits in, right, that's really not the carrier's fault. It's the employer buying the cheapest thing they can get their hands on, and stuff like that we can't really control. And all we can do is customize a plan to meet in the best way it can your existing plan and go from there. But all the schools that we've done this with, we have had great success with that. The schools are happy. None of them have left those programs. They're still all using them. And now, from what I've been told today, the aid numbers are coming out and they're not good. So a lot of schools are really nervous.
Right. Yeah.
And they're being told that they can adjust the aid mid-year, potentially quarterly. So how are schools supposed to account for that? It's crazy.
Yeah, quarterly they could adjust this now.
Yeah.
It is crazy.
So.
And the savings from what you're offering it seems, it does, I hate to say it, it does seem too good to be true, but when you look at the comparison chart, it's right there.
Yeah. And we do, and we address, I mean, that's one of the first things I talk about before we get going is it seems to be too good to be true. How could these carriers offer us such a great deal, the same benefits with lower prices? And I address all that because there's a logical explanation for that. But I think all schools should be looking at this option if they haven't done it already, because this is a great way to provide benefits to the retirees in the same manner they're getting them now, and being able to save money for the district. And it's a long-term solution, not a short-term, and it's a good benefit.
Mm-hmm.
Have you heard any of the meetings so far?
I heard all three of them on Tuesday.
Oh, okay.
Yeah, so
you're a pro now.
So yeah, I could probably do your spiel for you. No, I don't think so. Don't worry. But I mean, it's confusing. There's a lot of things. There's a lot of questions, and when people talk about these passive thing, and terms that the normal people we don't hear these terms, but there's a lot to it, and people are nervous. Nobody likes change. I think that's a big thing.
Yep.
So, doing these meetings, I think, is a really good idea.
Yeah, no, well, it's all the only way we can do it. I mean, there's no way that you could make a decision like this without talking to retirees and explaining to them to put their minds at ease, because, there's just a lot of anxiety over the whole issue. And I understand that. I've been doing this for so many years, and it always starts out the same way. Everybody's very nervous. They don't know if they don't know. And we explain to them how the programs work. And when they get on the programs, they work exactly that way. And and they have us, they have ENV as their advocate to help them in the event there is an issue or there is a question. We're here to help. So I think that's a big thing too.
That's a huge thing, just to be able to call your office rather than call the carrier or the provider or whatever you call it. And, get right through to you guys if you have an issue or a concern.
Yep.
And you're based in Syracuse, right?
Yep, that's correct. Yeah.
Okay. So how many districts do you do this for?
I think we've got, I work with 130 school districts, and I think that we've got
Wow.
about 40 or a little over 40 that have done this,
Okay. That have done this group plan.
have done this group Medicare plan. We're in the middle right now of
Okay.
talking to another, about a dozen.
Mm-hmm.
All the Cuga schools are looking to do this now. Like I said, with the aid numbers coming out today, I would be shocked if we didn't get probably, 4 to 6 phone calls in the next couple of weeks asking for us to come out there and talk about this type of stuff to help them.
Really? Because if people were to just buy this on the open market, they're going to get a lesser plan or they're going to pay more?
Both. They're going to pay
Okay.
more. It's going to be a lesser plan. It'll be limited benefits potentially. The donut hole would exist. I mean, so these individual plans on the street can't compare to what you guys are looking at.
Mm-hmm.
And from a price standpoint and benefit standpoint, it's a really good option.
Mm-hmm. So they still haven't gotten rid of that donut hole?
Not on the individual plans. No, they're still there.
Okay. Wow. I thought they were trying to phase that out.
I don't know. I think that because they're trying to keep, like in some plans, like in some Medicare Advantage plans, they might have a zero copay based on income, and because it's a zero premium, they put things like that in there, and some people don't care about the donut hole.
Mm-hmm.
I would be concerned about the donut hole if I was a retiree having
Yeah.
a gap in coverage on your prescription. If you take a couple prescriptions that are
Right.
expensive, you would certainly be concerned.
Right. And who knows what you're going to need a year from now or whatever. You don't.
Right.
And some of these drugs are ridiculous.
Right. Oh, absolutely. How many people do we have logged on so far?
Not too many. 5, including you and me.
And probably Kristen Wall from my office.
Kristen, yep.
Dawn Curtis from my office may be on here.
We got Cindy. She's from your office too, right?
Yep, Cindy's from Humana.
Oh, okay. We have an S, Eric.
Don't see you.
Right there.
I know.
Okay,
They
we've
don't-
got a few more customers. I think these people were at another meeting.
Yep, I recognize the gentleman, yes.
Yeah. And then I,
No mustache.
Yeah.
You should have your cowboy hat on.
Absolutely.
I guess he heard that.
You gotta turn your mic off of you.
okay, we'll give it one more minute. I have just 7 o'clock. Looks like it's going to be a quiet meeting. We're getting a few. Okay, Ed, what do you think? Should we get started on this?
Yeah, we sure can.
Yeah.
So I'll get started.
Okay. All right. Go ahead.
I was going to say good evening, everybody, and welcome to our 6th Shenango 4th partner at the ENV Insurance Agency. Online today with us, I think we have Cindy Wise from Humana, Kristen Wall from my office, and potentially Dawn Curtis from my office. And we're going to go through a couple of presentations today, quick PowerPoint on Medicare, on an analysis comparing the benefits that are currently in place now with what the options are. We're going to answer a bunch of questions, and then we'll open it up at the end. And I ask everybody to make sure that they mute their devices and save your questions for the end. We will not leave until we answer everybody's questions. The first thing I want to talk about is just a quick introduction to ENV Insurance Agency. For people that might not know who we are a 32-year-old employee benefit firm. We specialize in employee benefits. We have about 40 employees. We work with about 1,000 corporate accounts on the Northeast, and we currently work with 130 school districts in New York State, which is probably the most important statistic for you guys. So we're going to go down through here. Before I get into the PowerPoint that Linda's got on the screen, I want to address a couple of questions that kind of have gotten brought up the most, and I want to just talk about them right now. The first thing is, people are asking us about the timing. You know, why are we having this conversation in the middle of a pandemic? You know, it's not good timing. Everybody's nervous, and I would sit here and tell you, I don't think anybody would disagree with that. That timing here isn't good for anybody. Unfortunately, things do have to move on, and school districts do have to balance their budgets. Even though the budget got moved to June, or the budget vote got moved to June, they still have to balance their budgets. And from what I hear, the aid numbers came out today, and they don't look good. And also, we were told that the state can adjust some of the aid on a quarterly basis. So schools are really faced with a really hard time here. So I don't think anybody would disagree. We would all love it to be a better time. It just isn't. Another thing too is Shenango Forks is not the only school that's considering doing this at this time either. Canajahary is looking to make their move for retirees on 7/1. Madrid-Waddington is 7/1. Harpersville made their move for 4/1. Owego made their move for 4/1. And the earliest that Shenango Forks could even consider doing this would be 7/1. So this is not something that's going to happen overnight, and people are going to get blindsided. I want people to understand the district is not taking this decision lightly. This is a very serious decision. They want to look at it, and it's something that's just being, you know, we're doing a lot of due diligence. The second question is, why are we using a consultant versus talking to the carriers direct? And I've got a couple responses for that. The first thing is, not all carriers will work with clients directly. Some only work with consultants like myself. The second is the rates. The rates are the same whether people use a consultant or not. There is no discount for not using a consultant. The third thing is, a carrier can only talk to you about themselves. So Excellus can only talk to you about Excellus, and Hartford can only talk to you about Hartford. Humana can only talk to you about Humana, and Aetna about Aetna. So what a consultant does is they're able to put together an analysis like what we're going to look at here in a few minutes, and we can compare the good, the bad, the ugly, which will help people make a decision on, or in this case, help the district make a decision on which plan best fits their retirees. The fourth thing, which I think is the most important reason, is that at the ENV Insurance Agency, we have a call center with 9 people that work 8 to 4, Monday through Friday, and they're there to be your advocate. When things happen, when you get something in the mail that you might not, you might not understand, or if you have a claim issue, what'll happen is you can call our office and they'll take care of you. They're there to be your advocate. Claim issues pop up, we have a direct contact with all the different carriers, and we're there to help. That's a really big positive for a lot of our districts. Somebody had mentioned, is my camera messed up?
Yeah.
We're looking at the floor.
Yeah, there you go.
There we go. We're better?
That looks good.
Good. Sorry about that, folks. Thanks for telling me, whoever sent me that text. The third thing is, which we've heard a lot, if it's too good to be true, it usually is. So how can these carriers provide us with benefits that are as good or better for a much lower cost? And there's a few things to consider in that answer as well. The first thing is, Medicare is really your primary insurance, and Excellus is your secondary. Medicare pays 80% of all your claims. However, the school district gets charged the same amount of money for retirees as they do the active people. Okay, so that's a big, big difference. Medicare pays 80%, but the district's being charged as if Excellus is paying 80%. There's no discount. The second thing is, when people go onto a Medicare plan, they get put on as an individual. So if the individual rate is $500, a family or husband and wife would be $1,000. That same example under the Excellus current plan, if the single rate was $500, it wouldn't be $1,000. They use a factor, and the factor in this case is 2.5. So it would go from 500 all the way up to 1250. So there's a factor that they put in place so that raises the rate for families on that plan. So that's another big reason. The other reason is that Medicare pays these Medicare pays these Medicare Advantage companies to provide amazing services and great benefits, better benefits than what Medicare provides with subsidies. And they use these subsidies to do that. So between the subsidies, the lack of the factor, and the fact that, we have the 80% factor of being paid by Medicare, that's the big reason why that these rates are different. The other thing is, keep in mind, like when I do an analysis for school districts and we have a bunch of carriers come in, if there's an outlier there that's really, really low and everybody else is in a different category, usually we look at that carrier and say they're trying to buy the business. In this situation here, as you can see, or you will see, that Humana and Aetna are very close in price, and Excelis Medicare supplemental policy is not that far off. So it's not just one carrier coming in here substantially lower. All three carriers have a substantial amount of money to be saved here for the district. So as I get into the presentation, remember, please hold your questions till the end. I promise that we will answer all the questions. The presentation is designed to answer most of your questions, and then we could open it up again and go from there. So we get into the PowerPoint. Linda, if we could go down a couple pages to where it says Medicare plans right there. And sorry, let me put my glasses on. The first things we talk about Medicare supplemental policies and the difference between a Medicare sup policy and a Medicare Advantage plan. And a Medicare sup policy is just that. It supplements Medicare. Medicare pays first, the policy pays second. You still need to be covered for Part A and Part B. That was a question earlier. You still need to be covered for Part A and Part B. That doesn't change. There are deductibles and co-insurance with Medicare, but the Medicare sup policy picks those all up, so a retiree would not have to deal with a deductible or co-insurance. Under the Medicare supplemental policy, the Part D prescription plan, the Part D is required, but you have three different ID cards as well. You have a Medicare card, you have a Medicare supplemental card, and you have a prescription drug card. Also, you may have heard in 2020 that Medicare changed some of the plan designs, and Plan F, and the Plan F is the one that we use all the time because it's 100% coverage. If somebody was 65 years old prior to January 1st, they could stay on Plan F, would be no issue. Anybody that was 65 after January 1st, 2020 would go to Plan G. The only difference between Plan F and G is that on Plan G, the Part B deductible, which is $198, would not be covered. Okay, so that's something that's new that's happening. So we're really, as I do this presentation, we're really focused on Humana or Aetna. We are talking about Excelis benefits, but you'll see there's a few categories where Excelis can't meet the same criteria. So the plans, in my opinion, are not going to be as good as a Humana or an Aetna plan. The Medicare Advantage plan provides Medicare benefits through a private insurance company. It includes the Part A and the B and the D. They're all covered. The out-of-pocket costs depend on the type of plan purchased. So remember, what we're doing is we're customizing a Medicare plan based on your benefit needs or your benefit plan designs currently in place now. The district told me they're not interested in having anything offered that would not be considered as good or better than what they have in place today. And then you have one ID card for all benefits. The other comment on here, I have Medicare plans, network is irrelevant. The reason I say the network is irrelevant is it compares to the in-force Excelis plan. People get, I think, caught up sometime in is my doctor part of this network, and do I have to worry about this network, and who's in the network and who's not in the network? We no longer have to worry about that. If a provider accepts Medicare or they accept Medicare assignment, you should have no issue. 98% of the providers across the country either accept Medicare or will do Medicare assignment. With Excelis in our 31 county area, they also have a 98% provider hit number, okay? So 98% of the people in the 31 counties are part of their network. But on a national basis, only 80% of the providers across the country participate with a Blue Cross Blue Shield program, okay? The only time we have any issue with providers typically is when a provider becomes a private contracting physician and says, Linda, pay me $5,000 a year and you'll have access to me 24/7 and sign this contract and we're good to go. If anybody had that kind of situation, they would know about it now because those people don't accept any coverage, not even the existing Blue Cross Blue Shield. Next page, passive. I say passive network. And the reason I talk about this is is these plans are PPOs, but not really PPOs, because in a PPO, you typically have better coverage in network and not so good coverage out of network. These programs here under the passive network, it's the same coverage whether a provider is in the network or not. So you may see a provider that says they don't accept Humana, but they are in the network and they will accept the program because it's a passive program. And I know that's a little confusing. I know some people have gone online and have tried to look at the providers to see who's in and who's not. We actually have told people, if you email me your name and number, we can have Humana and Aetna call you, and they'll verify your providers for you and verify your prescriptions for you. Because a lot of times people will think their provider is not part of the program when actually they are. So there shouldn't be any, I've yet to see any issue with a provider on these programs. Retirees don't have to worry about billing. So they billing claims are handled directly with the carriers like you have it now. So you shouldn't have to worry about any billing issues as well. I also put in here on the next page frequently asked questions. The first one there talks about what's the difference between a Medicare Advantage plan and a Medicare supplemental plan. We already talked about that, but what I want to point out here is that with Aetna and Humana under the Medicare Advantage plans, they get a star rating, and Medicare has them make sure to keep that star rating. They've got to provide amazing services and great benefits, and that gets them their subsidies. So both Aetna and Humana are rated 4.5 out of 5, which is very good. Somebody earlier asked me what Excelis was rated, and the Medicare sub plans are not rated the same way. They're not given the same kind of subsidies as the Medicare Advantage plans, which is why Medicare Advantage plans have more coverages. Will I have to switch my doctors? I always get asked that question. As long as your provider accepts Medicare or does Medicare assignment, you should have no problem. 98% of the providers nationally will accept Medicare in some form. We really haven't had issues with providers on these plans. And you'll see in a few minutes, I've listed a number of schools that we've put on these programs in the Central New York area and the Southern Tier, and they've been on them for years. And we would know if we had provider issues. How are claims processed? Medicare Sup, under that situation, claims go to Medicare first, and then the Medicare supplemental policy comes on top and pays the balance. Under the Medicare Advantage, claims are submitted directly to the Medicare Advantage carrier only. What tier is my prescription on? The nice thing about your current plan of the Classic Blue is you have what we call a 210 program, which means you pay $2 for generic drugs and you pay $10 for a name brand drug, okay? Under the PPO plan, which I believe there's 6 people in Chenango Forks, they have the PPO plan, you have a 5-15-30 plan, which means you pay $5 for generic, $15 for preferred name brands, and $30 for non-preferred name brands. So with the 210 drug, I mean, it's pretty simple. Is the drug either generic or is it name brand? Pretty simple. We don't see a lot of disruption on those kind of programs. The carrier we select will have an open formulary. What does that mean? The formulary is the list of prescriptions that these carriers use. And we currently, with the Classic Blue plan, have an open formulary. With the PPO plan, it's a closed formulary. With the Excelis Medicare sub-plan, it's a closed formulary. And with Aetna and Humana, it's open. And why I say open is important. It means that they're using all the prescriptions that they can. Okay, you shouldn't have any issue finding prescriptions. A closed formulary might reduce the number of name brand prescriptions that they use because of a cost situation. One thing I talk about here is tiers. Drugs can change tiers. It happens all the time. A lot of drugs that are name brand drugs will become generic drugs. Sometimes they change a generic drug a little bit and it becomes expensive and it becomes a name brand drug. So what happens here is if a drug is going to go down in copay, they can make the change as needed anytime. If it's going to go up in a copay, it can only happen once a year in January. The industry standard on most plans is quarterly. We used to see drugs change tiers on an annual basis, and now they make them on a quarterly basis because the pharmaceutical companies are changing things all the time. The next page, the question is there a donut hole? I was just talking to Linda about this prior to our meeting, and we do not have to worry about a donut hole on this program. If you buy an individual plan on the street or through TV or brochure, you will have to deal with a donut hole. Here you do not. This is a group policy not an individual policy. And these benefits have been customized for you. This is a program that you could not buy off the street. So you will not have to deal with a donut hole at all. Is there a pre-existing condition clause? The answer is no. If somebody is dealing with cancer or heart issues or diabetes or whatever you have, there is no pre-existing condition clauses to worry about. What happens if my spouse is over 65 as well? If your spouse is over 65, they can join the plan as well. Keep in mind, the plans that we're talking about are only for post-65 retirees only. Anybody that's not 65 yet, this would not apply to them. What happens if my spouse is under 65 and I'm over 65? If your spouse is under but you're over, you could go over to the Medicare plan and your spouse would stay on the active plan until they turn 65. Do I need to be enrolled in Part A and B? The answer is yes. Okay, earlier I got asked a question, does my Part B premium change? The answer should be no. Okay, and if the district is paying the Part B premium, it will continue to pay so. What happens if I have any questions or problems? Like I said earlier, ENV has a call center. We're there to be your advocate. I heard a couple people in earlier meetings talk about they had issues with this plan or issues with that plan. What I found out was a lot of them were just dealing with these issues themselves. They had nobody to act on their behalf. And when somebody gets to be older in their 80s or into their 90s, it's really hard for that person to understand sometimes these insurance programs. So having an advocate for them that's going to act on their behalf is really important. So we have all the people in our office will have these benefits. So they'll know what benefits you guys have. And we have 2 people in my office that are CMS experts. They're certified CMS people, which are Centers for Medicare Services. All they do all day long is work with post-65 retirees. The last page is the list of schools I had mentioned earlier, and that's a list of schools that currently have some kind of Medicare program. And in full transparency, I will tell you that under Shenango Valley, they moved some of their retirees. They did not move the teachers, okay? The other thing I want to mention is Johnson City should be on this list, but they're not. Johnson City has been with Humana for about 4 years now, okay? Earlier, I think I talked to a gentleman who had called and spoke to Shenango Valley, Deposit, Walton, and I think it was Johnson City. And what he found out was that they all had different companies, all different plans. Shenango Valley had Excelis, Deposit had Hartford, Walton had Aetna, and Johnson City has Humana. And that's possible because based on the group size and based on your benefit plan design, certain carriers are more competitive than others. So the point we want to make here is we're trying to put in the best plan that's going to meet your needs, not just, one widget doesn't fit for everybody, okay? That concludes the PowerPoint section of our presentation. Now Linda's going to put up the analysis here. I'll go down through. And again, it's kind of long and tedious, but we'll get through this. And the way this analysis kind of is broken out is on the left-hand side, we have your current Excelis Classic Blue plan. To the right of that is the PPO plan, and there are 6 people in Shenango Forks that have the PPO plan. And then we have the Medicare benefits to the right of that. And then we have the Excelis Medicare Sup policy with those benefits. The shaded areas on my sheet, they're green. On your sheet, it might be a light gray if they're black and white. What I've done there is I always label the benefits. Is it going to be plus, which is better than, the same, equal to, or is it going to be negative, which will be less? And in this case, I used red. So on your copy, it might be a dark gray. To the right of those columns would be Humana, and then how do they rank, and then Aetna, and how do they rank, okay? So that's how the spreadsheet is set up. So as I start the presentation, and forgive me if my voice crackles, this is the 3rd presentation today that we've done, but we'll definitely get through it. So the first thing is, under the Excelis plan, you have a deductible of $50 per individual and $150 for family. Under the PPO plan, there's no deductibles. They use copays. Under the Excelis Medicare Sup policy, you can see Medicare has a deductible of $1,408 for Part A and $198 for Part B. The deductible is covered under the Excelis plan, okay? So the retirees would not have any deductible to have to meet. So that coverage would be as good or better than what we have in place now. Then Humana and Aetna don't have any deductibles. So there is no deductible to meet there at all. So those also are going to be as good or better than what we have in place currently. Standard copayment means, are you paying copays? Under the Excelis Classic Blue, there are no copays other than your prescriptions. It'll be co-insurance, which we'll talk about next. Under the PPO plan, it's a $10 copay. Under the Excelis Medicare plan, there are no copays, so the plan will be the same. Under Humana and Aetna, you'll see it's a zero copay. A zero copay means you pay nothing at the time of service. So those three companies are going to be as good or better than what we have currently in place now. Co-insurance, 20%. 20% means after you met your deductible, you pay 20%. Excelis pays 80% until you reach an out-of-pocket maximum of $400 for a single and $1,200 for family. Under the PPO plan, there is no co-insurance because it's all copays. Under the Excelis Medicare plan, there are no co-insurance. Everything's paid 100%, so it doesn't apply in this situation. Same thing with Humana and Aetna. Okay, there is no co-insurance at all to meet. There's no deductibles, and there are no co-insurance. Okay. Lifetime maximum, excuse me. Lifetime maximum under our current Blue Cross plans are unlimited. Under all the plans that we're talking about here, Excelis, Humana, and Aetna, they're also unlimited. So the benefits would be as good or better. Office visits. At the next section, doctor visits are subject to deductible and co-insurance under the Classic Blue plan. Under the PPO plan, you pay a $10 copay. Under the Excelis plan, it's 100% covered after Medicare. So Medicare pays their portion, then Excelis pays the balance, leaving the retiree nothing to pay out of their pocket. So it's going to be as good or better than what we have in place now. And then under Humana and Aetna, you can see there's zero copays. So it's going to be as good or better. A question earlier today, actually the first day, that somebody asked me, what is the difference between zero copay and 100% after Medicare? What does that mean? And the answer is there is no difference. Both languages mean it's 100% coverage. So 100% after Medicare means you pay nothing, and a zero copay means you pay nothing. They mean the same, it's just the way that the carriers list their benefits on their summary sheets. Chiropractic care. Chiropractic care is subject to deductible and co-insurance under Classic Blue for spinal manipulation only. Under the Excelis PPO, it's a $10 copay. Under the Excelis Medicare plan, it also covers spinal manipulation only, not routine, which matches what we have currently on the Blue Cross plans. Under Humana and Aetna, they not only cover spinal manipulation with a zero copay, they also cover routine maintenance under chiropractic care. That's a big benefit. There are a lot of people that do routine chiro and currently does not have it covered. That's an enhancement. Also, one thing that I want to mention here before we get down to the preventative stuff is we did have some updates on this spreadsheet with Humana. They've updated and upgraded some of their benefits, and we did not send out a different spreadsheet to people because we didn't want to confuse people having different versions of what I'm talking about out there. We did send the district a chart with the upgrades, and I will discuss every upgrade as we get to them on this spreadsheet. So I just want you to be aware that there are a couple changes that we did upgrade because they needed to make sure that the benefits were going to be as good or better than what we had in place from the existing plans. The next category is preventative health services. And you can see under routine physicals, adult immunizations, mammographies, pap smears, prostate screenings, bone density testing, all that is paid 100% under the current Blue Cross plans. Under the Excelis plan and the Humana plan and the Aetna plan, they're also all paid 100%. No difference. They're going to be as good or better than what we have in place currently. Next page, we get into routine vision exams. Routine vision exams are not currently covered under either Blue Cross plan, and they would not be covered under the Excelis Medicare plan. So that's the same. Where it says Humana, this is the first upgrade for Humana. It says not covered. Humana is going to cover an eye exam once every 12 months with a zero copay to match what Aetna did. So both Humana and Aetna should say the same thing, and that's an enhanced benefit from what we have today. Eyewear, frames, and lenses or contacts. Under the Excelis plan, they cover, after you have cataract surgery, they will cover a pair of glasses that are part of the cataract surgery. And the same thing happens with the Excelis Medicare program. They'll cover those glasses for the cataract surgery, so it's the same benefit. Under Humana and Aetna, it should read the same thing. Currently, Humana does not. Humana initially put in there a zero copay for the cataract glasses, but then a discount through IMED. They've changed that to also read the same thing as Aetna did. So it's a zero copay for the cataract glasses, but then you get to use a $100 allowance once every 12 months for a vision reimbursement program. So because it's an allowance, you basically go out and use it for glasses, then submit to get reimbursed. That is also an enhancement than from what we have today. Hearing evaluations under the Classic Blue plan are deductible and coinsurance, and under the PPO plan, they're a $10 copay. Under the Excelis Medicare plan, it's covered 100% after Medicare, and under the Humana program, it's a zero copay, like it is with Aetna, one every 12 months. So that's going to be as good or better than what we have in place currently. Hearing aids. Hearing aids are not currently covered under either Blue Cross plan, and they're not covered under the Excelis Medicare plan. Under Humana and Aetna, this is another upgrade for Humana. Initially, Humana had a discount program on there. They've upgraded to match the Aetna program. So both Humana and Aetna will have a $600 allowance every 36 months for hearing aids. Another big addition. The next category is inpatient services. So for inpatient hospitalization, inpatient mental health, and inpatient substance abuse, they currently are all paid 100%. With Excelis Medicare program, Humana and Aetna, they are also all paid 100%. You pay nothing. Same thing with inpatient physician visits. Currently, they're covered in full, and they would also be covered in full under Excelis, Humana, and Aetna. The next page, we get into skilled nursing. Skilled nursing under the Blue Cross plan is covered in full. Under the PPO plan, is covered in full up to 120 days. And under the Medicare Excelis plan, it's covered 100% up to 100 days, not 120 days. So we've labeled that as a negative. Under the Humana program, it currently says zero copay for days 1 through 100, and the plan pays nothing after 100 days. That has been upgraded to now read it's a zero copay with unlimited days for benefit period. So now Aetna and Humana are going to match the Classic Blue program, and it's going to be a zero copay, unlimited days. We did get a question on skilled nursing that somebody asked us if we could ask all the carriers the criteria that determines how many days somebody would need skilled nursing. So we're in the middle of putting it together and report that back to the district. My belief is going to be they're all going to be pretty much the same thing, that they're going to rely on Medicare guidelines and probably a case leader that's going to put notes in there to see when a person would go from skilled nursing to potentially home health care. But we're going to get that answered from all the carriers, and we'll submit that back to the district. Emergency services. Emergency room currently is paid in full under the Classic Blue. Under the PPO plan, there's a copay of $50. Under the Excelis plan, it's 100% coverage after Medicare. And under the Humana plan and the Aetna plan, they're both zero copays. Under the Aetna plan, it says it includes worldwide coverage. Humana does as well. We actually have a column that addresses international coverage. Are we getting some feedback? I just want to make sure that I'm still coming through clear. I thought I could hear some feedback, so okay.
No?
Next category is urgent care visits. Urgent care visits are subject to deductible and coinsurance under the Excelis plan. Under the PPO plan, they're a $10 copay. Under the Excelis Medicare plan, it's covered 100% after Medicare, so it's going to be as good or better. And under the Humana and Aetna, it's a zero copay, so it's also going to be as good or better. And you can start to see the trend here. Under the Excelis Medicare plan, everything's covered 100% after Medicare. And under the Humana and Aetna plan, we have zero copays for everything. So the out-of-pocket expense for a retiree on these plans is very low. Outpatient benefits, outpatient surgery, paid in full under the Classic Blue plan. Under the PPO plan, it's a $10 copay. Under the Excelis plan, it's 100% after Medicare. And under Humana and Aetna, it's a zero copay. So again, as good or better. Office surgery, currently subject to deductible and coinsurance. Under the Classic Blue, under the PPO, it's a $10 copay. Under the Excelis Medicare plan, it's 100% coverage after Medicare. And under Humana and Aetna, it's a zero copay. Again, as good or better. Diagnostic lab testing, currently paid in full with Excelis Classic Blue. Under the Excelis PPO, it's a $10 copay. Under the Excelis Medicare plan, it's 100% coverage after Medicare. Under Humana and Aetna, it's a zero copay. Again, meeting the requirements of as good or better. Next page, we get into radiation therapy and chemotherapy. Currently, they're paid in full under the Blue Cross Classic Blue. Under the PPO plan, there's a $10 copay. Under the Excelis Medicare plan, they are covered 100% after Medicare. And under Humana and Aetna, there's 0 copays. So all 3 carriers are going to be as good or better. Outpatient mental health currently is subject to deductible and co-insurance under Classic Blue. Under the PPO plan, it's a $10 copay. Under the Excelis Medicare plan, it's 100% coverage after Medicare. Under Humana and Aetna, it's a 0 copay. So also as good or better. Alcohol and substance abuse for outpatient facilities, paid in full, 60 visits per year. Additional visits may be available. Under the PPO plan, covered in full. Under the Excelis plan, it's 100% coverage after Medicare. Under the Humana plan and the Aetna plan, there's 0 copays. There's no limitation to days. So we don't have to worry about 60 days limitation on that benefit. Other services, therapies, physical therapy, speech, occupational, pulmonary, and cardiac therapies. Currently subject to deductible and co-insurance under Classic Blue. Under the PPO plan, it's a $10 copay. With the Excelis plan, it's 100% coverage after Medicare. And under Humana and Aetna, it's a it's a 0 copay across the board. So they're as good or better. Diabetic supplies and equipment education currently is covered subject to deductible and co-insurance. Under the PPO, it's a $10 copay. Under the Medicare Excelis plan, it's 100% coverage after Medicare. And under Humana and Aetna, it's a 0 copay. You can see under Aetna, it says include supplies for monitoring blood glucose. That applies to Humana and Excelis as well. They all have that. Durable medical equipment, currently subject to deductible and co-insurance. On the PPO plan, it's a 20% co-insurance straight. Under the Excelis Medicare plan, it's covered 100% after Medicare. And under Humana and Aetna, it's a 0 copay. So again, as good or better coverage. Prosthetics, subject to deductible and co-insurance, no calendar year maximum. Under the PPO plan, it's a 20% co-insurance with a $15,000 a year max. Under the Excelis plan, it's covered 100% after Medicare, no max. Under Humana and Aetna, it's a 0 copay, no max as well. Those plans will be as good or better than we have in force. Home health care, paid in full, 60 visits per year with 325 additional visits under enhanced benefits. Under the PPO plan, covered in full, unlimited visits. Under the Excelis Medicare plan, it's 100% coverage after Medicare. And under Humana and Aetna, it's a 0 copay, no limitation to days on either or all 3. So that's going to be as good or better than what we have in place now. Hospice care, paid in full, 210 days under the Classic Blue, covered in full under the PPO plan. Under the Excelis plan, it's 100% coverage after Medicare. And under the Humana and Aetna plan, it's a 0 copay. So as good or better. And there's no limitation to days like there is with Classic Blue. Dialysis, paid in full under Classic Blue. The PPO plan's paid in full as well. Under the Excelis plan, it's 100% coverage after Medicare. On the Humana and Aetna plans, they are 0 copays. So they all match the enforced benefits. The last benefit on that page is acupuncture, currently not covered under either Blue Cross plan and not covered under the Excelis Medicare plan. It is, however, covered under the Humana and Aetna plans with a 0 copay, another added benefit. Get to the last page, we have the top line is international coverage, and I have TBD on there because Excelis didn't have that benefit in their summary, but I know that emergencies covered outside the country are covered as any other service, so there would be no issue there. Under the Excelis Medicare plan, emergencies are covered within the first 60 days of travel, subject to a $250 deductible and 20% co-insurance, $50,000 lifetime max benefit. That's a negative benefit. It's not as good as what we have in force now. Both Humana and Aetna are going to cover 100% of the benefits for emergency services covered outside the country, and it's the same as what we have here internally. Lifestyle wellness benefits, currently under the Excelis plans, they don't have any. Under the Excelis Medicare plan, they also don't have any. Humana and Aetna have what they call a Silver Sneakers program or Resources for Living. It's a rewards program. There's plenty of discounts there, but the most popular program is this Silver Sneakers program. Retirees ask me about this all the time because not all Medicare programs have it. And what it is, it's a gym membership program where retirees can belong to as many gyms as they want, whether they're in New York State or if they're in Florida, North Carolina. It's a really good program and very popular. So that is a plus benefit. The next category is prescription drugs. Okay. Under the Classic Blue, you have what we deem as a 210 drug card. You pay $2 for generic drugs and you pay $10 for name brand drugs. And if you get a 3-month supply, there's a discount. You pay the same copay. So there's an advantage there for you. There's no deductible and there's no annual out-of-pocket max. If you're on the 5-15-30 plan, okay, it's $5 for generic, $15 for preferred name brand, and $30 for non-preferred name brand. There is no discount for a 3-month supply. There's no deductible, and you can see there's an individual annual out-of-pocket max just for those prescriptions, $3,000 for single and $6,000 for family. Under the Excellus program, they did match the 210 program exactly. They did not give us information for the 5-15-30, but we do believe that they would give that to us. They just haven't done it yet. Under Humana and Aetna, they have both matched both programs exactly. And under Aetna, they actually gave us a little bonus for 2020. If we chose them, the out-of-pocket maximum for the rest of the year would only be $1,500 versus $3,000. So a small discount there. As you can see, that the Excellus program is an open formulary, as is the Humana and Aetna, and the closed panel formularies are the PPO and the Excellus Medicare. Now, one thing I want to mention here is 2 things. I think there was an email thread going around. It is possible that Excellus, as your secondary payer, has covered your Excellus deductible and your co-insurances. Okay, that's called CO. We refer that as COB, coordination of benefits. That could happen. Now, the reason I bring this up is it doesn't mean there's any deterioration of benefits on the right-hand side. Those benefits on the right-hand side with Humana and Aetna are still going to be considered as good, equal to, or better on all those benefits. And one thing we have to worry about is the limitation of days. And I think I mentioned you've got the chiropractic benefit that's addition, the hearing, the vision, the international, the wellness program. So there's a lot of other programs there still that you didn't have. But I know that got mentioned earlier. I want to just make sure we address that it is possible. I don't think it happens with everybody, or everybody wasn't sure, but it is possible. The other thing I want to mention too at this time is the district has said to me that if any unforeseen expenses would be denied, the district is willing to self-insure those expenses. Now, as I make that statement, that has to be negotiated. Okay, that is something that if the board gives the approval and Mr. Pack gets to go negotiate with the bargaining units, that has to be negotiated. So I don't have any terms of that deal or how it's going to look. I just know that they are agreeable to self-insuring any differences, should there be any benefit differences. Then on the bottom of this page, we look at the rates. I don't think that people realize just what the district pays for health insurance. I think they understand what they pay, but they don't really see what the district pays. Under the Excellus plan, you can see under the Classic Blue, it's $813.92. That's the gross cost monthly the district pays for all single people. For the family, they pay $2,035.97. Under the PPO plan, they pay $759.85 and $1,885.81 for family. That is the gross monthly cost they pay each month. And then retirees, based on your bargaining unit, you pay a small portion of that as well. You can see under the Excellus rates, their rate for a single would be $489.54. So it's not half the cost, but close. And then a family coverage would be double that. Under the Humana program, it's $305.19 for the 210 program, and it's $515, or for the 5-15-30, it's $251.64. Under the Aetna program, it's $369.19 for the 210, and for the 5-15-30, it's $337. And all you would do for family coverage is double those rates. So what I've done is I kind of took, and I don't know what different bargaining units pay for coverage, but I used a number of 10% and 15%. But at 10, if you paid 10% of the coverage as a retiree under the current program, you would pay $977 a year for your cost. A family would pay $2,436 for the cost. That same 10% brought over to Humana would cost that same retiree $366 a year for a savings of about $600 per year. and a family cost would be $732, which is about $1,700 a year less in cost. If you pay 15%, which I believe a few people that I spoke to did, because they told me they were paying over $3,000 a year for their coverage, at the 15% number, a single person would pay $1,465, and a family would pay $3,663. That same 15% number on the Humana side would be $549 for a single, for $900 a year savings, and $1,098 for family, which is $2,500 a year savings for that family. So not only is the district going to save money on these programs, but all the retirees will save based on their contribution as well. One question that did get brought up, somebody asked the district, is this, we considered this to be a short-term solution or a long-term solution? How do these plans work and what are the increases? So I took the Humana rates and I conservatively raised them 9% every single year, and it would take us to the year 2031 to get to the current in-force Excellus rates today. If I then took the same formula and raised Humana 9% and then added the Blue Cross rates and added 5%, which is also conservative, at the 2031 year, there was still a substantial difference in rates. So the answer to that question is this is not a Band-Aid approach. It's a long-term solution. I think I've mentioned earlier, all the districts that I have that have gone to these programs are all still on them, and they've been on these programs for years, and they have not moved off. That is the end of our presentation. That is a lot of information in a short period of time. So what I'd like to do now is open this up to questions, and then we can answer all your questions. Or if you would prefer, you can email me your name and number, and I will have Aetna and Humana contact you to answer your questions.
I have a question for you, sir.
Are you on speaker?
Yep, I can hear you, sir.
Okay, I was looking at the internet about the definition of Medicare Advantage plan versus a Medicare supplement plan. And the definition, one of the distinctions on the internet seems to be that the Medicare Advantage plans require physicians and facilities be in the network.
Yep, that's a good question. And under this plan here, that would not be true. If you go back probably 5 years ago, these passive plans that we're talking to you guys about have been in our area for 5 years. They've been across the country for many more years. And before 5 years ago, our agency would not have recommended a Medicare Advantage plan because you're absolutely right. You used to have to be part of a network. And then if the networks were different from what we had with Excellus, it was not going to be a program that we would recommend. Now, these programs are all passive networks, which means the providers do not have to be part of a network. If they accept the Medicare program or they do Medicare assignment, you should be good to go. So we don't have to worry about, is a provider part of the network? The question that you want to ask a provider is, do you take Medicare or do you do Medicare assignment? I think that Humana actually developed a letter that explains that to providers, because when we did Maine Endwell a couple of years ago, there was a few providers in the area that were confused on that. So Humana had put together a letter explaining to them this is a group program that's passive. So as long as you are part of the Medicare system or the Medicare assignment, we shouldn't have any issue. And once we circulated that letter around, we were fine.
Does that apply to the Advantage plans purchased, the non-group plans, the individual plans?
That's a good one. I don't believe it does. I think if you buy an individual plan, you do have to worry about the network. That's correct. Right. Cindy, are you on, Cindy?
Yes.
So continuing on that vein, I talked to my family provider down here. I talked to his office and said, do you accept Humana or Aetna? And they said, only if it's a PPO.
That's correct. And it is
Go ahead.
And that's correct. It is a PPO.
Yep.
This is a PPO.
That's correct. Yep.
Mm-hmm.
Oh, okay.
He's like an antibody.
Now, following an additional thread on that, I guess if I don't worry about networks, I don't care. I'm a snowbird, so I live in Pennsylvania and in Florida in the winter. Does that mean there's two different networks?
No, really, again, there's no network to be worried about. If a provider in Florida is part of Medicare, or does Medicare assignment, you're good to go.
Mhm.
Okay, because I know my physician does take Medicare.
You should have no problem.
And just to throw this out as a extra, it's too late, I can't think of the word, but to make you feel better, I would suggest perhaps you send your name and telephone number to Ed, and I think we would be more than happy to check your providers' names in Florida and in Pennsylvania.
My wife already sent that in.
I didn't leave a telephone, but I can do
Yeah,
that.
but if you send me the name, your phone number, we'll call you back and we'll verify all your providers for you, just so you have an extra comfort level.
Mhm.
And I have a question. I'm a cancer survivor, and I have to get a PET CT scan. I can't even talk. A PET CT scan every year. I don't see where that's listed at all.
I don't think it was, but it is covered.
Right. Yeah, PET scans and MRIs and CAT scans, all that stuff is under the testing section, and that stuff is all covered. So you would have, as a cancer person dealing with that every year, you should have no problem at all.
Mhm.
Thank you.
Any other questions?
Yeah, I have another question. I hate to monopolize though.
No, that's okay, sir. No, they're good questions.
On your chart, the first page, one of the line items is out-of-pocket maximum,
Yep.
and under Humana and Aetna, it says none. So, but I think that's not quite correct,
It
because
should say just
that
doesn't
implies
apply.
there is no maximum. And I think you said that we weren't going to worry about paying any money out of our pocket.
You're correct. It really should say doesn't apply. It should say NA,
Mhm.
like I
Yeah.
have with the Excel.
Yeah,
So it should say
that's
NA.
just a chart
Yeah.
correction.
Yep. Anything else?
No. No, I do not. Thank you.
Okay. Linda, anybody else have any questions?
Let me see. Nobody's got their hand up? No, I guess we're good.
Okay.
Good job.
Well, thanks everybody for attending tonight. And like I said, if we get your phone number and your name, we'll contact you immediately and try to get you as much information as possible. I think that Cindy, myself, and Kristen Wall have all tried to respond back to people immediately so we get their answers. And if anybody has any questions that pop up later, please don't hesitate to email us your question as well. And we hope that you guys found this very educational and informative. And we look forward to working with you guys.
Thank you.
Thank you.
And
guys.
just so everyone knows, we're recording all of these meetings and we're posting them on the Shenango Forks website. So if you go to the homepage in the top banner where it's in red and then the white that says retiree health insurance information, if you click that and scroll to the bottom, we have the videos of all of these town hall meetings. So you can see what other people had to say or other questions that might be helpful to you. So,
And a good point,
Actually,
Linda.
I will ask one other question.
Oh, sure.
Is this package is only for retirees only? What are you doing with current employees, insurance-wise?
I don't believe that there's anything being done with the under 65 employees at all right now. I don't think they just went through a negotiation. I really don't know. That would be a question for Joe to answer. I don't know if they just did negotiate, but as of right now, I don't believe that's a conversation. But on to Linda's point, what I wanted to add is Kristen Wall from my office is writing down every question from every meeting, and we're going to create a document, and we'll get that over to the district so that everybody can have all the questions from all the meetings to review themselves as well.
Wouldn't have to listen to
Actually,
his last.
I'll do a Columbo on you and do one more question, sir, one more question.
Sure.
The ENV call center,
Yep.
that's going to be an ongoing effort. That's not only during this negotiation period?
Oh, that's a great question. No, our call center is ongoing for all of our clients. We use it all the time.
All right, thank you.
Yep. Anything else?
Nope.
Well, I hope everybody has a good
Yes,
weekend.
I have a question.
Oh, yep, no problem.
Where on the Shenango Forks page are the minutes or the notes that you're made?
If you go to the home page, at the very top of the page is a big red banner that has all the information about school closing. And at the bottom of that banner, it's a white band that says retiree health information. If you
Yes.
click on that, it takes you to all the documents, questions and answers, and all the information. And if you scroll to the very bottom of that page, you'll see videos of all of these town hall meetings.
Okay, terrific. Thank you.
Okay.
Okay, with that said, everybody have a good weekend and a safe weekend, and we'll talk to you soon.
Oh, there they are.
Okay.
Thank you.
Thank you.
Thank you,
Good night,
guys.
everyone.
Take care.
Good night.
Stay well.
Good night.
Peace.
Documents.